committee. You can fill out a slip. Not seeing any. There will be a second opportunity if you missed this one. Our first agenda item, I would entertain a motion to approve the award of funding to 8 county security members in an amount not to exceed $8,000. Your agenda says to exceed $8,000.
Oh, not to exceed.
Not to exceed $8,000.
I'll make that motion.
Motion. I have a motion and second.
So just very briefly, when the county was awarded money from the state called HEROES money, it qualified for individuals that worked in district or in 911 courts, jail, the jail, and then the road patrol, but did not cover individuals that were retired police officers that are working in court security. So there are 8 of them that did not receive $1,000 as a result of it. The sheriff has asked that they be included to receive this out of the regular ARPA funding because they are deputized officers or certified officers that otherwise would have been qualified if they weren't in this special designation as court security.
So were they also not given ARPA
They were given
money?
the ARPA money.
They were given the ARPA money.
Yes, that is correct. So this is just the HEROES money that they were not given, that extra $1,000.
Were the road patrol, the COs, they were all given ARPA money too?
Yes, they were.
So this just makes everybody equal?
Yes, it does. For those certified police officers, those 8 individuals that were missed, $1,000 apiece.
Any questions, discussion?
It's an allowable expense under
Yes.
ARPA.
That is correct.
Anyone else? All in favor of moving this on to Wednesday night, say aye.
Aye.
Any opposed, same? All right, motion moves to Wednesday night. Item B, I would entertain a motion to approve the replacement of a juvenile caseworker.
I'll make the motion.
Support.
I have a motion and support. Any discussion, questions? I think we have Sarah here to make a presentation.
Yes, this is just to replace our caseworker who's retiring at 27 years, Tara Cuddy, so we'll be looking for her replacement. She's done at the end of July, so it'll be nice to get it posted now, hopefully, so that we can have some overlap possibly, or if not, at least no gap.
Okay, any questions?
Congratulations on 27 years in the retirement. It's a long time.
Yes. Oh, I could add one other thing. Tara, who's retiring, is a senior caseworker, so she's in a next level up. So this will actually save us some money because we'll be hiring not a senior caseworker because that requires 10 years of casework service. So it'll save us some dimes.
Have you guys anybody in mind or not? Oh, I didn't know sometimes you had people in the background.
No, so if anybody knows anybody, you just need to have a bachelor's degree and hopefully some experience with juveniles or adolescents. I mean, that's not absolutely required, but a bachelor's degree is required. Anybody knows anybody who's interested in having a apply?
Okay.
Assuming you approve it.
Thank you.
All in favor of moving this on to Wednesday night, say aye.
Aye.
Any opposed? The motion moves on to Wednesday. Item C, approve a contract between Monroe County and Shiawassee County for youth treatment.
I'll make that motion.
Motion,
Support.
motion and support. Sarah.
Yeah, so this, I think I mentioned this at maybe a leadership meeting that somebody were at last month. As you all know, there's been a real problem finding any sort of placement for our juveniles through COVID and up until now still. Detention centers are still not opening their doors to us, and there's a real sort of trend away from detention, pure detention, because that's basically the straight incarceration for juveniles. Really, there's a trend to leaving them in the home and giving them whatever we possibly can and for treatment, which we do anyway. That's what probation is. But to get more intensive services, and then only in the event that that isn't going to work, then we seek residential treatment for them. I will say, sadly, one of the things is that we have very, very, very limited resources in our county. We do everything we possibly can. We have, graduated consequences in our probation type of thing, but we have, as always a number of children who just can't maintain in the home because they really need some sort of treatment. Kids don't need to be locked up. They need treatment, whether it be mental health treatment, a whole lot of them, whether it be substance abuse, whether it be trauma-based stuff for PTSD. There's so many things that these kids are needing. And those beds are equally as hard to find as detention. We have been really, really lucky to find a couple of them through COVID, but a lot of that's through relationships with places because everybody's looking. I mean, everybody's looking, but we've really developed some rapport. And so Monroe County has one of the lowest rates of any residential facility anywhere. That's what this contract proposal is. They are, as always, in great demand. And everybody wants to go there because they can get treatment for their kids cheap. Our staff has had a really good relationship with Monroe. And they approached me and basically said, we love Shiawassee County because you guys are easy to communicate with, you are work. And they have picked 2 counties that they want to exclusively contract with to provide beds. And what these are, scary sort of, these are, we pay for them no matter whether we use them or not, but we will use them. Frankly, we already have one kid there, and as soon as they have an opening, we have another one that we have in Cincinnati in a facility that's more expensive that we're waiting to put in there because we like to know better. So we're gonna have 2 kids there anyway. So it's, that part of it's already in place. And those would be these 2 beds. But what it is then them saying, we will devote these 2 beds to you for a whole year for you to use, and we can leave them in there 90 days, we can leave them in there 6 months, depending on how they work their program and what their needs are and when they're met. We can pull them out even before 90 days if we need to, but for a kid to really get treatment, you're not going to do it in much less than 90 days. I mean, you could say 30-day treatment, but really what do you do in 30 days, But if they wash out, we could. I don't want to talk about that. But, sometimes they can be maintained in place. So what this is this us wanting to partner with Monroe County. They're also doing it with Lapeer, maybe? I'm sorry. I don't know what county. Some other county, they're doing this with exactly the same thing, so that they can limit who they work with, and then we have beds guaranteed for us.
And if you would, for the sake of the committee, I know you and I talked about this afternoon, this comes 50% from the child care fund, 50% from us, unless the juvenile is 17, and then it's 100% from the child care fund. So I know we had a discussion about what that number is, but it is half of that comes out of the general fund.
Right. And securing these 2 beds is roughly half of my budget for residential treatment. So doing this contract and knowing what that would cost me for you, that's roughly half of my residential treatment budget, which it's all right. I mean, that's, doesn't mean that's the only kids we can place, but it's about half our budget, which to me is reasonable and isn't too scary because it still allows me to do something else if I need to somewhere else. If it's something they don't touch, or don't do or can't get in there.
You feel pretty certain that a large percentage of the time we're going to be using both of those beds?
I feel like we will use the beds 100% of the time.
That's what I was gonna ask, was
Can I
how many
promise
days
that?
a year do we have 2 juveniles? That would be always.
Sometimes they have a lot more.
2 is minimal. I mean, yeah. You take historically detention and placement, we've never only had 2 kids. Now, granted, some of those were detention, but the price of Monroe is more similar really to a detention center. They're very small, they're county run, so they're not like a big dollar, but they have really good social worker, really good therapist. I mean, we have a good relationship with them. It's not an unknown. They've done really good work with our kids, but yeah, 100%. Tony, my caseworkers already have a list. I want this, of who gets to go first. Like, I think you should go first. Although right now we really already have it sort of full right now. So, okay.
Any questions? Oh, sorry.
Yeah, so one last question. Would they be willing to, so it expires December 31st. We'll have to come back in December or November to renew. Are they open to that? Because this is really only a 6-month contract, right?
I didn't notice that. Thought it was a 1 year. I guess I didn't even notice that it expired on this is a contract that and that's even, I'm not gonna say better, but.
Page 2, it says, and shall continue until December 31st,
I guess,
2022.
oh yeah, I did say, okay.
Maybe that was a typo on there, I mean.
It
maybe
could be,
that's
because me
just
and I
wrong.
talked about a year, but.
Okay.
But we have been talking about this for a few months, so, yeah.
Can you find that out for tomorrow? I mean.
Yeah, I kind of like that, they
Okay.
renew it, if it goes well, they renew it, but I kind of like it because, you know,
Then we're not-
I'm putting myself out here too, and it's like,
Sure.
great, then maybe it gives us that chance to look at it too, so I kind of like when it goes to.
Sure.
Just because I can sort of, you know.
See how it works.
Like
Okay.
I said, we can never make any promises when we come here, but it gives us that chance to say, okay, this is fun.
Sure.
But they would renew it, and I would just put it back on the agenda for renewal with you guys, I don't,
Okay.
you know, I know how to get here, obviously. Any
Sure.
questions?
Did you have a question?
I did, I'm a little uncertain of the budgetary impact. The half thing, 2 beds, full-time, $175,000, it's about $128,000 a year, plus treatment costs.
That's not plus treatment costs, that's with,
Well, it said here.
that's only if they need additional.
Right, if they need substance abuse counseling, which I assume isn't an infrequent thing. So that'll be more. And what did we spend last year on this sort of thing is my question from the general fund.
I'm gonna be honest with you, let's not even look at it, because everything was closed down with COVID.
Well, you said this is about half of your residential treatment budget.
Yeah, it's about half.
Which part is? I mean, we're talking about it being split between
Right, well,
general
that's
fund,
just it.
general fund and which other?
Child care,
So,
the child care fund,
yeah, so if you look at it,
Which
it's
is
a
part of your budget, the child care fund.
Yeah, so.
and
if you-
reimbursable, right?
But half of it would still come from the general fund, $60-some thousand.
It all right, so it's so complicated, so,
Yes.
yeah. So the child care fund has the budget of, I have it here, for my residential treatment, on page. For residential treatment, I have 231, and for detention, I have 121. So combined, because sometimes we will put funds back and forth depending on which one we use. So combined on those, I have 350. That's why I sort of estimated about half, but it was just a little hard. So of that, say I spend 100,000 of that, we then submit to the state, they give me back at least 50%. If it's a 17-year-old, they give me back 100%. There's also a talk, and we can tell you from the past, we're going to 60-40, 65-35. So at very minimum, we're gonna get half of that back. So you kind of have to look at that expenditure and everything and think half. But we have to spend it up front, so it's not like that's all that goes out. We have to spend it, and then they offset it and come back from the next month that we owe. So it goes out at 100%, comes back,
It goes out at 100% from the child care fund,
and then comes
and then
back.
comes
from the
back.
Reimbursements.
Yeah.
If I just make a side comment, personally, as you know, some of you might have noticed that I'm a little bit stingy with dollars. But of all the things we do, taking care of children is our duty to take care of especially some of these children, horrific situations and so on. It's more important than our new building. It's more important than fixing the courthouse. It's pretty much more important than anything we do. So if this is affordable and it will help, I don't know how I could not support it. But I would like to look at, if we go for the first 6 months, the first year, I would like to have more details on what it costs and what the occupancy was and so on.
Oh, absolutely.
I think
Yeah, I just can't really do.
before there's any
last year.
renewal of it,
And it would be,
I would tend to support this barring someone having a strong argument against it.
it'd be great to see numbers and say, okay, do we need 3 beds? If it's within budget, do we need 3? Do we need
On
more?
that
I don't
note,
know.
one of the other perks I didn't even mention was, he said that he will also then, if we're in this partnership, give us first refusal on
Oh.
if we want somebody else in there. So it's not like, I mean, right now we have somebody there, so, but he loves us so much, he said, we do this contract and we have a bed open, we're gonna call you first and say, do you need this or this other bed?
Well, and it sounds like it could potentially actually save us money if you're not sending kids to Cincinnati, which you also, I'm assuming, have to pay mileage and
Yes.
a person to transport and all of that,
And it's higher.
and it's higher.
Mhm.
So that whole cost,
Yeah, it's really It's really a kind of a win-win. I mean, it just really is, it's the lowest rate building, and if we can secure 2 beds for it, we're gonna come out ahead. And even though it is scary, the whole, you gotta fill them every, I've already told my staff that. You know, it's scary for all of us, but it's not.
Okay.
That leads me to another question, and I think it'll be the next topic too, is the transport of the juveniles. How does that happen? How do they get there?
John knows about our cars. It sort of depends on the day.
Okay.
We use our transport cars, which we have to have. Sometimes facilities will transport, if they have the ability. Monroe is small if they don't typically do that. So basically we have transport cars and our deputies typically go. The deputies assigned to report goes with the caseworker.
Okay.
Sometimes it's 2 caseworkers, sometimes it's me, sometimes it sort of depends on the day. But we typically do the transporting in our transport car.
Okay.
Let me comment on transporting. A few years ago, we had some vehicles that had a lot of miles on them. That's a nice thing to say. And so what we did is, in the budget year, we asked Sarah, what do you need? So we bought her a car, a brand new one, through the best day pricing, you know, like we buy cars. And then we also bought a vehicle that is basically like I'm not gonna say it's like a deputy's patrol car, but it's similar. When the people in the back cannot get out unless the people in front
It's a
let
cage,
them
it's
out.
got a cage, yeah.
Yeah, it's got a cage. And each year during our, when we talk about budget coming up in July and August, I always ask Sarah, I said, Sarah, do you need a new vehicle? And she says, well, our one vehicle, they get serviced. How many miles do you have on the vehicles? Because we had a little problems several years ago was these vehicles were impounded vehicles that was given to your department to transport people. A lot of times you could see through the floorboards. And these were not the type of vehicles you want to be taking children in or the people transporting them because they were breaking down the road
With kids in them, yeah.
with kids in them. So that's why we have very, very good vehicles for them to drive. And again, I'll ask her this year, well, here's your vehicle, how many miles? Is it time to turn that vehicle over so you have something that's very, very reliable?
And I usually say, no, we're good, which I think is probably the
Yeah,
answer
yeah.
this year.
I mean, we don't really put a lot of miles on them, but as a board, like I would echo Greg's, if they're gonna be transported to Saginaw or Monroe or Boys Town in Nebraska or something, you better have a vehicle that can stand the trip.
Thank you, John.
Yep.
All right, any other questions on item C? All in favor of moving this forward to Wednesday night, say yes.
Aye.
Aye.
It's fine, either or.
I've been using yes on
Yes.
some meetings because it's just way easier because all the ayes come in too late and you can't tell who voted yes or no. That moves forward then to Wednesday. Item D, I entertain a motion to approve the contract between Father Flanagan's Boys Home, Boys Town, in Shiawassee County for youth treatment.
I'll make the motion.
I'll support that.
All right, Sarah.
Okay. This is a contract that we've had in place. This is a renewal. This contract's been in place probably for 20 years, I would say. And in my tenure as court administrator, now when I was prosecutor we used them, but we haven't used Boys Town in probably 15 years. So this is not something I anticipate coming up, because if you'll note, like the price at Monroe is $175, I think, right?
Mhm.
And you can see the price starting at $5 is $584. Now that is for their highest level of services. They do have a 236 level, which is more reasonable, but a lot of kids, you don't know, they get to sort of turn. Boys Town is a very unique beast, and there are very, very unique kids that we don't get very often, but sometimes that's just where they have to go because they can't be in any other facility. They're just really, I hate to say it, very sad, but just very, very broken souls who need some really high end. I don't anticipate it coming up. We obviously haven't used it in a while, but I do like to keep it in place because then they lock in our rates, then they don't raise them. on us, and then we at least stay in their system, that if we ever needed to go that route, we would. But it also, I think, really illustrates what a great deal of Monroe is if you look at Boys Town. But Boys Town is the gold standard, to be honest. It is.
And that one is different than the Monroe County in that it is only pay if you stay.
Oh, yeah,
Right,
yeah,
yeah.
it costs us
Just a
nothing, and like I said, we
contract,
haven't used it, I don't think in 15 years, so it doesn't cost us. So, I can't promise you I would never put
Right.
anybody there, but it would have to be a very, very unique situation.
But to use it, you have to have this contract.
I'd have a contract to use it, yeah.
And I'll just comment too, I know that in the past, we have had people that, or young men, that ended up with this. And it was very, very expensive, but that's what happens sometimes. But not legally.
Okay. Any other questions? All in favor of moving item D on to Wednesday, signify by saying aye.
Aye.
All opposed? Item D moves to Wednesday. Item E, I entertain a motion to approve the invoice from Rave Mobile Safety in an amount not to exceed $9,500.
I'll make that motion.
Support?
I have motion and support, discussion. There's a face we haven't seen in a little while.
I'm glad you haven't seen my face. Madam Chairman, this is our annual renewal for our Rave mass communication system for $9,500. And they did offer a 1-year renewal. I'm trying to negotiate the price down because we don't use some of the features of the system. So hopefully the invoice will be less than $9,500, but that is still to be seen. But it will not be over.
This comes out of his home.
Yes.
Security grant.
Yes, this is grant funded.
How many subscribers do we have?
2,200,
Okay.
which is for a population of 68,000 is
Very
not
low.
great. It's
Yeah.
low.
We also do use it though for the county system as well, for
Yep.
their county employees.
Yeah, on the backside, what you don't see is it's used for the sheriff's office to call back on overtime. Of course, our monthly test for our employees.
Sure.
So there's a lot of use that you don't see. But we, I hope in the future, unfortunately, the reality is it takes an incident for people to sign up for it. And we just, thank God, have had none of those incidents as of late. So we hopefully continue with that track, but see what we can do.
Okay.
Okay.
I know it's not my committee, I wonder, how much it might cost us to send a flyer out to every household? It wouldn't be 70,000, but for every household, just to make them aware that this exists. You might see a spike up at,
We do.
It takes some general fund.
That would be helpful. I don't know the logistics of doing that, how that would work, but I'm sure it can be done. We advertise it at the fair. We advertise it on social media. The system is a little more complicated to work than other systems that are out there, but I did look at other systems and they were almost double the price. So unfortunately, you kind of get what you pay for. But I would be all on board with that. That'd be great.
One thing to do is maybe meet with Karen, meet Alfred from the Independent and do a story on it. That would be free to gain awareness of it. I'm sure the Independent would run a story on it. The other thing is we could also take out an ad in the Independent. That might be an easier route to try and get some awareness.
What about Facebook ads? Do those exist? I'm not a good Facebook user, but that might hit the younger generation.
We do send it out on social media for dispatch and emergency management, but it's just hard to get, because you do have to go into the system, you have to create a username, a password, and there's a 6-month,
People off right there.
it does, because if you have to put any more than 10 seconds on social media to do anything, it loses its luster after that. But like I said, unfortunately it takes an incident to get people to sign up.
So do we pay the same amount regardless of the number of users? Is that how it works? or is
Correct.
it- Okay.
The initial contract was based on when we set the system up on your population, and I believe our pricing is the same as a population under 200,000.
Okay. So it's just flat rate.
Yeah, flat rate,
Okay.
based on your population.
Any other questions?
I just one if I could. So, what are the things that you would send out this alert? I know you said the in-county stuff,
Yes.
the back, I get it, but what about to the general public?
You can use it for road closures. You can use it for planned or unplanned events. Like we have used it in the past for closure for the county.
I've gotten tornado warnings, right?
Yep, tornado warnings are routed through the National Weather Service for what's called a WE alert, wireless emergency alert. The unfortunate part is that it's mandated that we have something because you have to be able to send out the WE alerts, basically the things that are very important that have to go out now. That's a requirement. But we can use it for just about anything, any type of alert, road closures, water over the road, anything. But it's dependent on how many people are signed up. You have to be signed up to receive the alerts. It's not like an Amber Alert that you get that's pushed out through the state for whatever reason that will hit your cell phone no matter what. We have that capability as well after going through about 25 or 30 hoops. We have that capability as well, but you can use it for about anything.
I'm not signed up, so I just wondered.
Gotcha. Yeah, it's you know it's a system that's good to use, but like I said, it's unfortunate that it takes something to get people to sign up. But we'll try our best. Really good ideas.
Any other questions or comments? All in favor of moving this on to Wednesday, say aye.
Aye.
All opposed? The motion moves forward to Wednesday.
Very good. Thank you.
Very much.
Thank you.
This is our second call to the public. Is there anyone who would like to address the public? Seeing none, I will say that this meeting is adjourned. And I have to before the next meeting, unfortunately.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Call to the public. Seeing no one, we'll move right into our first agenda item. I will entertain a motion to approve the contract between the Shiawassee County Health Department and the Shiawassee Regional Education Service District, RESD, for reflective supervision services for the maternal infant health program in an amount not to exceed $2,835 for a period of July 1st, 2022 to June 30th, 2023, and authorize the board chair to sign all necessary documents.
So moved.
Support.
All right, what do we have on this?
So it's just a contract renewal. 4 years we've had this contract now with the RESD. This is for home visiting staff in the maternal infant health program for basically mental health services for the staff because of the sometimes the things that they might see when they go to homes that Commissioner Broderick was talking about earlier. It's a requirement of the program that they are provided this service, and we don't have anybody on staff that can do it, so we contract with the RESD to do that for us. I'll just stay up here.
Okay, yeah, I think that sounds good. Anybody have anything on it?
I'm not on the, it's mental health for the
Our
health
staff.
department?
Correct.
Okay.
We're gonna send Larry.
I just wanted to make sure I understood what it was.
He's had a tough
We better up the
couple
budget then.
He's had a tough couple.
As we all, yeah. All right, If nothing else, all those in favor signify by saying aye. Aye. All those opposed, the same. So we'll see that one tomorrow. I will entertain a motion to approve the contract renewal with Shiawassee County Health Department and Shiawassee RESD for technology services for the period of July 1, 2022 to June 30th, 2024, and authorize the board chair to sign all necessary documents.
So moved.
Support.
All right, it's moved and seconded. Is that, so that's a 2-year?
Yep, 2
Okay.
year. It's following the county contract. We have a separate agreement with the RSD for IT services based on the size and complexity of our organization. Historically, we had a full-time IT person, but when that person retired a number of years ago, we tagged on to what the county was working on with the RSD and did the separate agreement, and the service has been excellent. And what's great about this, with all the inflationary costs, they held it steady for another 2 years. It's the same amount, $75,000 per year, and that will be 4 years straight of the same amount. And that's pretty unprecedented with the way prices are going, especially on any contract right now. So we're very thankful for that and for the service that we get from the RSD.
Oh, great service and a bargain.
It's-
It really is.
I'm surprised they haven't raised it up, or at least a little bit.
I was surprised.
Right, I know. That's,
Let's get her through Thursday.
Right, yeah.
all right.
Okay.
Anything else on this? Questions for Larry or? All right, all those in favor signify by saying aye.
Aye.
All those opposed, the same. All right, we'll see that one again tomorrow, which brings us to item C. I'll entertain a motion to adopt the 2021 Health Department Annual Report and place it on file.
So moved.
Support.
All right.
Well, this is our annual report. This year, we cut it down a little bit. It's about half the size that it normally is. It's a little more user-friendly and a little more readable. Most of the time, if you make it too long, people aren't going to read it. I would just call your attention to some of the highlights of the year. The big highlight, obviously, on page 3, were the efforts that the health department undertook in the response to COVID-19. As we went into 2021, the vaccine was coming in really slow to our county, and we were dealing with having to prioritize the limited amount of vaccine that we had to get school personnel and seniors vaccinated first. And so those were hard days when there weren't prevalent vaccines. Hard, stressful days, because there was a high demand for the vaccine at that time for people who were actually desperate to get it. So many activities, work, clinics, was a result of the excellent work by the health department staff. Obviously, recognition goes to them for getting that done. It was, 2.5 years we've been going nonstop at this. More recently, things have been getting a little better with the pandemic, so that's good for 2022. But 2021, we were knee deep in going all out. But at the same time, you'll see that we were still doing our other program. The health department was never shut down for the pandemic. We went full bore as part of the Emergency Operations Center. The work that my staff does is exemplary. They're, this has been said before, a high-performing county department, very high-performing. So that's reflected in this report, the good work that they do. So that's all I've got for you.
All right, anything?
Are you still trying to vaccinate people, or is
Yeah.
it kind of slow? Or?
Well, it's slowed way down
Oh.
because the people that have gotten it wanted to have had it, and anybody that wanted the boosters, obviously. Most people are eligible for boosters, but there are some limitations on it. But as we go into the fall, we're looking at this might be sort of an annual vaccine, like the flu vaccine, and they are working on a vaccine that is a combo between the flu and COVID. So they're waiting to do studies on that, and the variants have been changed. There's so many variants now. Thankfully, they've gotten more mild as we've been going on with the hospitalizations and the deaths declining. So it's kind of a wait and see pattern on what the vaccine looks like for the fall based on the conditions of the pandemic. I'm hoping we don't have another year of spikes and dealing with all that. And so hopefully we're kind of putting this in our rearview mirror, but we got to be mindful and be ready to respond if necessary. So.
All right, well, it looks good. Anybody have anything else on the 2021 annual report? All right, all those in favor of placing it on file signify by saying aye. Aye. All those opposed? All right. One more thing. I do agree with Larry, runs an exemplary department. I want to give a shout out, because I did go down in the basement today. The health department has removed the last of their records from the basement. A while ago, the health department did remove their records from the off-site facility on Hibbard Road, so leading the charge and consolidating those records and getting them where they belong and accessible, and I think we all appreciate that, so thank you.
Yeah, we might have a couple more boxes down there, but we've moved ours to Capitan, the basement over there, so we get it cleaned up into our storage space.
Yep, I think it's, Morgan is working on kind of a spreadsheet with department heads to figure out where the records are, maybe just get some idea of where we are countywide, so.
Were all the records had to be saved, Larry?
Anything that I don't have to save, I've tossed.
Oh, okay,
Certain records have the retention schedule, we have to follow that.
okay.
But any of the junk and stuff, we're clearing out. We have a couple shelves in the basement down there that we want to get cleaned up for mechanical components of wells and septics for our trainings. So we're trying to make some good room, but there's a lot of stuff down there. So.
Yep, we've got a lot of stuff. So, all right, anything else for this committee? Call to the public, going once. All right, we are adjourned, thank you.